again, I want to thank everybody for showing up this morning. We love hosting this event. We haven't been able to do it for a few years because of COVID, and glad that we're able to gather like this and provide this type of information to our community as well. But I know everybody's time is valuable, so I don't want to keep you here longer this morning than we have to, because we have a lot to cover. I'm Chris O'Brien, by the way. I'm the president of the Born Sandwich Rotary Club, and I would like now to introduce Marie. Louisa, thank you. I knew I was going to miss it.
No, that's okay.
Who is the president and CEO?
That's okay, George.
Thank you.
Thank you. Thank you. Hi, everybody. Marie Oliva from the Cape Cod Canal Region Chamber. For those of you who might not be familiar with us, we are located in the railroad station on Main Street, Buzzards Bay, and I'm also a member of the Born Substance Free Coalition. And I have to say, I've learned a lot from being on the coalition. When they talk about the hidden room and ways for drugs available for people, I really didn't have that much of an idea. And I have to say that Elizabeth Griffin, under her leadership, the coalition has become so strong with representatives from the police, the fire, Barcelona County Health, parents, everybody. So it's really made a big difference, and I think we can all get together and solve this as a community. So we want to reach out to the business and residential community to make sure that they know the legal responsibilities for if you have an employee or if you have somebody in your home. So thank you very much. We're happy to sponsor this, as well as with the Rotary. We want to thank you as well. Thank you so much.
And next, I want to introduce Elizabeth Griffin, who we all just heard about, and it really has spearheaded this, and we're very grateful to have her part of our club and a valued member. So please, Elizabeth.
I think so.
No, I just want to say thank you, and Marie, for your kind words. This is near and dear to our community, as we have faced, is this on? As we have faced and lost so many lives, and families have struggled so much with the effects of substance use in our community. So I want to thank Marie for her kind words, and Chris, it's a pleasure to be a Rotarian as well, because this also provides community collaboration. So with the Chamber, with Rotary, with the Born Substance Free Coalition, and the community members and the people that have volunteered their time to be here today to help address this issue, I just want to say thank you from the get-go. So what we'd like to do is first bring up Kate Mina. Kate Mina is the Substance Use Prevention Program Manager for Barcelona County Human Services. Her work focuses on creating connections between schools, towns, community organizations, and healthcare centers on the topics of harm reduction, prevention, treatment, and recovery. Kate serves as a resource on the substance use in our county. And please welcome her. She's a great asset.
Good morning, everyone. Like everyone has said, thank you so much for taking time out of your day to be here this morning. We appreciate your dedication to wanting to learn more about what's going on with opioid overdose in Barcelona County and on the Cape, as well as what you all can do as business owners and members of the business community to support your staff. So thank you for being here. So it's also, and the first slide is just kind of an agenda to let you know where we're headed with the rest of this presentation. So we're going to do an overview on opioid overdose. What does it look like on Cape Cod? So we'll see a little bit about what you've seen in the news. I think this is a really helpful way to gauge what's going on in our area, looking at the titles of news articles. We'll look a little bit into the numbers. So what are we seeing for opioid overdoses over the past, I think I put in there 5 years. I'll talk a little bit about what Barnstable County is doing, so focused on the work that I oversee, as well as the work that the towns are doing. And then I'll talk a little bit about some resources and what you all can do to stay engaged and to do more. So this is a slide that I put together for a lot of presentations, and a few years ago, a lot of the news article titles really focused on overdose. So, it was, we're seeing lots of overdoses. They focused on arrests due to substance possession. It was really focused on, kind of the problem. So the titles were more, I think, in a way, realistic, but also more focused on the negative. And one thing you can see up here, and I tried to get, article titles that were more recent, is we're really focused on what's happening. So what are the solutions that are being implemented to address this issue of overdose? And I think we're seeing that for two different reasons. So one, a lot of the coverage over the past 2.5 years has been focused on the pandemic. So I think there's not as much coverage on overdoses. We know the numbers have not gone down. In fact, the pandemic has exacerbated the issue, and we've seen increased numbers in overdoses, and we're getting back to, for the Cape 20 and most of the state, 2016 was when those fatal overdose numbers really spiked. And we're getting very close to those numbers in 2020. You'll see in the next couple slides that we're waiting for the data for 2021 from the state. But even from 2020, we see those numbers starting to climb. So we know the problem's not gone. We know people are still dying from overdose and still having non-fatal overdoses. So where's the coverage? On the other hand, there's a lot more that we're doing to address this issue. And that's really good that the coverage is focusing on the solutions, because it does make us feel like there are things that we can do, which we've always known, but when the coverage focuses on it, it's out there. It gives other towns ideas on what can be done. So I think in that aspect, it's a really good thing. We do know that we need to keep talking about this issue. We do know that we need to keep reporting on it. So thank you, Warren TV, for being here. And we also know that there's been a lot of progress. So even on here, so there's a title in here about Paths to Recovery gets a detour as 12-step programs go remote. So we know that these are things that we need to continue to adjust depending on what's going on in the world around us. New momentum for addiction treatment behind bars. That is a huge piece of progress. We haven't seen this kind of dedication to provide these important medications for folks who are incarcerated until very, very recently. So there is so much good that is happening. All right. So this is where I would ask if you need to look at your slides that are in front of you, because I know the next couple slides are a little data heavy and the numbers can be small. So what we're looking at right here is Cape Cod towns opioid-related overdose deaths, all intents by city, town, and location of overdose. So this means these are the numbers of overdoses that occurred in each town. So regardless of residence of the individual, these are the number of overdoses that occurred in Barnstable, in Bourne, in Truro, all across the Cape. All intents means that we're looking at unintentional or undetermined, so we're not sure what happened. People weren't intending to overdose, but they do also include overdose death by suicide, so an intentional overdose. And I talked a little bit about, seeing that peak in 2016, so you can see on there, for Barnstable County, we had a high of 81 fatal overdoses, and then in 2017, 2018, 2019, those numbers are a lot lower. They're still too high. We don't want to see anyone dying, and these are deaths that can be prevented, and we know how to do that. But in 2020, you see that number get back up to 76, which is, like I said, pretty close to the 81 we saw in 2016. So We know that the pandemic made things worse. The instability in the world in general, the instability in employers, in not knowing where folks are getting their money from to pay rent, food, childcare. All of these things make addiction and mental health. All right, so we've moved on to all intents by the residence of the individual. So if you can look at both of those slides side by side, we're going to see that there's a difference, right? So we know that looking at the town of, say, Barnstable, in 2020 we saw 30 fatal overdoses occur in the town of Barnstable, regardless of residence of the individual. When we look at the number of Barnstable residents who fatally overdose, that number goes down to 14. So that tells us, something that we already know, that people travel across lines for a lot of different things, to food shop, for childcare, but they also travel across town lines to buy substances, to use them. And because of that, people overdose in different towns than they live in, or maybe that their last known residence was at. So I think there's a few things that this means. It doesn't mean Barnstable should put a big fence or wall around their borders. That's not effective. It means that Barnstable needs to coordinate with the other towns around them. So I think these two slides really show that events like this that bring people together from different towns, the efforts that the county does that brings everyone from across the entire Cape together are really important. Regional efforts and regional programs are going to address this, moving across town lines. We can't just focus on, what's happening in our one town. We really need to work together. And the more that we can all communicate about it, talk about it, brainstorm ways to address this issue, the better we're going to be.
One question for you. So I don't understand what figures 18 is on the first page and 24 on the second. That means 6 or 8, 6 died somewhere else that was in residence, is that?
Yes.
I'm sure the others are the same.
Yep, yeah, so 6 Sandwich residents overdosed and died somewhere else. Yep. So they've traveled to Warren, they've traveled, across the bridge to Wareham, Plymouth. Yeah, that's exactly what that means. See, one more question.
Yeah, okay, sorry to interrupt, but this,
No, that's okay.
Barnstable and Falmouth seem to be high, but is that because the death occurred at the hospitals? Those were where the hospitals are located?
That's a good question. That's something I can look into to see if that's how this data should be interpreted. Because that is a really good point. Because I think it is. They're talking about where the person's death was called. So that could be one reason why the numbers are a little higher. I think also Barnstable and Falmouth are 2 of our bigger areas. I think also those 2 towns are where a lot of services are focused. Thinking about the AIDS support group, so folks are accessing Narcan and clean injection supplies. Those are 2 big hubs for services in general. So I think there's a few factors that could be coming into play there. Also, and then one more factor that could contribute to that, thinking about transportation lines. So, Hyannis within Barnstable is where all the buses are coming into from off Cape. Falmouth not being too far over the bridge, but there's the ferry from Martha's Vineyard. So these are kind of hubs where folks are traveling into that I think contribute to higher numbers. Yeah, sure.
Actually, I just want to reference it to Joe. As far as the overdose deaths, which Chris just said, could it be that because Falmouth and Hyannis have the hospitals, do you find from a 911 call, the majority of deaths are occurring at the site when you're going out on a call, or do they occur at the hospital after you bring them to the emergency room?
I would say at the site, but as far as how it's recorded, I don't know.
Yeah, it's a good question. So that's something I can look into and try and get a response back. Are there any other questions about the data? And if something pops up later towards the end of the presentation, feel free to ask it then. All right, so we're going to talk a little bit about what are we doing in Barnstable County. I'm going to focus somewhat on the projects that I'm involved with. That's what I know best. But you will hear about, the town coalitions as well. So we have I talked about, the data showing the need to have coordinated, comprehensive responses to this issue. So one way that we do that is through the Regional Substance Addiction Council. You'll hear me refer to it as the RSAC, because the rest of it is a mouthful. So you'll see that on our website as well, the RSAC. So the purpose of this is to establish communication across towns, providers, organizations, individuals. So part of my job, really kind of simply put, is to bring people together, making sure we have the right people around the table to figure out the priority areas for our county to respond best to addiction and substance use. It's a coordinated and comprehensive regional approach to substance use across the continuum of prevention, treatment, harm reduction, and recovery. So we've got a multi-sector representation from stakeholders, a couple stakeholders in the room. We have Duffy Health Center, AIDS Support Group, Trudy's been a part of the RSAC, the Born Substance Free Coalition. So we try to have, as many folks from different sectors participating, because that's going to give us the most comprehensive and holistic kind of ideas on what we should be focusing on. And these meetings are open to the public, so if anyone is interested in attending, the next meeting is on May 5th at 3:30. They're virtual meetings for now. And our next meeting will focus on the Opioid Remediation and Recovery Funds. So that's referring to the lawsuit that the Attorney General's office has taken on to sue the big pharmaceutical companies. So this next meeting will talk a little bit about what funds are coming to the state, what funds are coming to Barnstable County, to the individual towns, and kind of start that conversation of what should we be doing with these funds. And that website on there is how you get the link to the meeting. You can also reach out to me directly. My business cards are over there, and you'll see them on the slide as well. And then the last point I wanted to make about the RSAC, so we've got 4 work groups. These are also open to the public, so folks are welcome to join. There's a work group on prevention, harm reduction, treatment, and recovery. So the work group meets, most of them are every other month. I think the recovery work group meets every month right now. But we're always looking for new members. I think members of, Chamber of Commerce are an important partner in this. So, please feel free to reach out if you're interested in getting more involved in the work. They're really rich discussions, and the idea is to be action focused, not to, have a meeting to set another meeting. So we try to really do things and create action plans. All right, and what is happening with the Town Coalition? So this event is a great example of what some of the towns are doing. The Born Substance Free Coalition, I think, has been hosting this event for 2 years. And I know when we sent out the notice about this event, I got feedback from other towns who said, oh yeah, this is so great that it's coming back. This is, inspiring me to try and start one in Mashpee and Falmouth again, because they recognize how important it is to have you all here. So that was good feedback. We don't have coalitions in every single town currently. So right now, the 5 that you see up there are the ones that are actively meeting. So we've got one in Bourne, one in Falmouth, Mashpee, Yarmouth, and Dennis. There has been some movement recently to restart the Sandwich Coalition, so if folks do live in Sandwich and would like to be involved, you can reach out to me or anyone in the room here, and we'll get you connected to the right folks. If you live in a town where there is not a coalition, and you feel like this is something you'd like to take on or even just support, reach out to me. I attend all the town coalition meetings. This is a great way for the county to know what is happening in each town. I also report out on what other towns are doing during other coalition meetings to to try and bridge those, those gaps and make sure that folks have ideas on what to do.
There's not one in Boston.
There's not one in Barnesville currently. Yeah, so I mean, if that's something, you're interested in taking on, or at least, just it sounds like covering. You probably have a lot of free time covering the entire, district with Rotary. But really, I mean, and it doesn't have to be a big lift. My job is to support these coalitions and to support new ones forming. So while I cannot be, the chair, I will do everything I can to help start them. So reach out if you are, if anyone is interested. And I guess just to give a quick, so this is one event. The Born Sepsis-Free Coalition is also organizing a sticker shock event. So having stickers on the bags at different liquor stores, something that the students are involved in. So there's, go to the liquor store, you have a bag that has a sticker with information on it. You kind of can't help but look at that sticker. It'll stick out, no pun intended. There are lots of events that the other towns do. The Mashpee Coalition organizes a drop-in night. Right now it's been on pause because of COVID, but they're trying to figure out a way to maybe do it virtually. But the idea basically is a big health fair on a monthly basis where residents can come and get information on the different services that are available in their town. So there's lots of different ideas on what the coalitions can do and what anyone can get involved in. All right, and then lastly, so my position is funded, which is great because it allows me to get paid. But more importantly, it allows us to do a lot of really good work. So there are 2 grants that we received from the Department of Public Health. The first one is called the Overdose Data to Action Grant. The original funding source for this is the Center for Disease Control, so the CDC. And this grant is really supporting work on strategies intended to prevent consequences related to opioid misuse and addiction. So that means overdose prevention, that means relapse prevention, anything related to addiction that we can work to prevent while not focusing on the primary prevention. So this isn't a youth prevention focused grant. We have 2 subcontracted programs under the OD2A grant. The first one is Wellstrong Inc., which is located in Falmouth. They have a peer wellness program, kind of one-on-one coaching model that they're able to offer, really kind of dedicated services to each individual person as a member of this program. The second one is the Town of Dennis partners with Duffy Health Center to have a recovery support navigator that is dedicated to providing recovery support services to Town of Dennis residents. And then finally, we have the Mass Call Free. We're a Part B recipient. There's a lot more information on that if folks are interested, but kind of the quick version of it. It's a SAMHSA grant, so the Substance Abuse and Mental Health Services program from the federal government. And the idea behind this is really focusing on that primary prevention, so working to prevent youth from starting use even one time. We're in the really beginning stages of this grant. So right now we have our RSAC prevention work group serving as the core planning group. So we've got members of the community working in prevention and youth services and addiction services who are helping to inform where this grant should go. And then the biggest part of this grant for year 1 that I'm really excited about, so back in 2015, the county did a baseline assessment on substance use in Cape Cod. We know that 7 years is a long time to not have the data. Even without a pandemic, a lot changes in that amount of time. So we felt like it would be really important to redo this data, this assessment. We have data to compare from 7 years ago to today, and we also will get a better idea of where should our priorities lie today in 2022. All right, so what can you all do? Keep learning. Coming to events like this is really great. It gives you networking opportunities, it gives you ideas on how you can support your staff, create proactive, staff-supportive addiction, mental health programs and policies. That's something that there's a few folks in the room who are going to talk a little bit more about that later in the program today. Having an employee assistance program is really great. Having that support, that anonymous support that staff can call into and get the help that they might need. Having Narcan on site and making sure that all staff are trained in it on an annual basis. So just a one-time Narcan training and then not talking about it for 5 years. We really want to make sure that folks have that, repetitive information. So just implement it into any annual trainings that you're doing anyway, first aid, CPR, job site safety, kind of anything like that. Just throw, a Narcan training in. The AIDS support group is a really great trainer, and you'll hear from Donna later. But we have good trainers, in the area that can do this for you. Creating lines of open and honest communication with staff. So I think communication is the best way to break down that stigma and let people know I am here for you. And once the open, honest, conversations are able to happen, that's when the real work can start. Joining a town coalition, or maybe starting one if your town does not have one. Attending an RSAC meeting. Like I said, these meetings are open to the public, so you can come jump on. Virtual, so no travel time, and just listen and hear a little bit more about what's happening. And if you want to get even more involved, you can join an RSAT work group. All right, so a few resources. The Barnesville County Human Services Employer Toolkit. So I have about 20 copies printed over there in the dark blue folders. It doesn't have everything because some of the toolkits that were inside this toolkit were 40, 60 pages. So I did not print everything, but it is all accessible from our website. So if you want to read it online, if you'd like a paper copy, you feel free to take one. But if not, it's all online, and you can find the OSHA guidelines for safety and health programs, an employer's guide to workplace substance abuse, how to plan and implement a drug-free workplace program, and more. There's so much on there, tons of resources. If you do have folks who are looking for services, so whether it's someone within your organization or company, or a family member, a friend, yourself, the Barnesville County Network of Care Service Directory has a lot of different resources, so organizations in our community offering treatment, recovery, prevention, Narcan, HIV testing, mental health services. It's all in that service directory, so check that out. If you've got time this afternoon and you want to continue your learning, there is a training, it's a virtual training, it's called Employment as a Social Determinant of Addiction. It's put on by the American Institute for Research. They're a really great training group, and these trainings are recorded, so even if you can't watch it today, you can always find it on that website and watch it another time. And that's all I had. I'll put on a cute dog to end it, but if folks, I know people were asking questions throughout, but if there are more questions, I'm happy to take them.
EAPs are in most established larger businesses, organizations. The CAPE is made up of hundreds and hundreds of businesses that employ less than 5 people. Has the county looked into some type of option for EAP that small businesses located in other towns? Because, we're getting a groundswell of money into the county pretty soon. And it seems to me that there should be no business or organization, no matter how small, that would not be able to offer an EAP, even if it's one person in a staff of 5 needs it. So, any thought on that?
Yeah, well, I think that's a great idea, and a really solid observation. So, one way that we've talked about it within the county is we know that behavioral health services, particularly for our youth and young adults, those wait lists are so long. Sometimes you can't even get on a wait list, and they are just as long for adults, but even, kind of more dire needs for these young adults. So we've talked a little bit about having a counselor that's based out of the county that can serve residents of all towns. It's still very much in the works, but you're right, there is a lot of funding coming out, and a lot of the funding focuses on what I was talking about at the beginning of this presentation, having that regional coordinated effort. So I think it's an idea that I will bring back, to my bosses, because I think it's a really strong idea.
Because if the county was able to contract with so many units of service, and that small employers throughout the Cape could access it, that would open up EAP to many, many more workers on the Cape.
It would. It's a really good idea. So yeah, I will bring it back, and we'll talk a little bit more about it, because I think I don't always, since I'm not a business owner or even the head of a nonprofit, I don't always think about, the barrier, or I don't always know about the barriers to accessing services. So it's easy for me to be up here and say everyone should have an EAP, but knowing what prevents employers from being able to have one is really important. So I appreciate that feedback.
I don't want to add a lot more time. Can you just touch upon, this is the Rotary Club of Born and Sandwich, so I'd love for the audience to hear just a brief snippet of the HEAL study and the chart band.
Sure, yeah. So have folks heard about the Healing Community Study? Oh, yeah, great. So the Healing Community Study focuses on Born and Sandwich. It's a 4-state study, and Massachusetts is one of them, alongside Ohio, Pennsylvania, and New York.
Ohio, Kentucky, New York.
Ohio, Kentucky, New York. Thank you. And the goal really is to reduce opioid overdose deaths. So there were 2 phases of the study. Born and Sandwich were chosen to participate in phase 1, which meant there was a coalition, there was a lot of support from the state. New programs were implemented, one of which is the chart plan. We have Dana here representing the chart plan today. They offer harm reduction, recovery, and treatment services that folks can access right from the van. There was an increase in medication for opioid use disorder. Programs within the fire departments. You'll see there's a resource bag on the table, the first table there. The fire departments are giving out with support from the Born Substance Free Coalition. And yeah, really the goal was to bring folks together, think about creative ways to address opioid overdose. And I think the overall goal for the entire study was to reduce overdose deaths by 40%. So, and this the study is ending in 2 months, the end of June. So I think some of the services will continue, but I think we've learned a lot from the Healing Community Study, and it'll help us moving forward.
Very helpful.
All right, thank you.
I just want to thank Kate. As you can see, she's just a wealth of information. But we did this in 2019, pre-COVID. It was a way to actually reach out to small businesses, to give them the information of what they could do as an employer, or if you had an employee who struggled with substance use. And so I think you brought up a great point as far as at the county level, if we could make something, as there is a large amount of money coming in. But I also want to say the Born Substance Free Coalition is just a group of people, dedicated, committed individuals within our community, and we're all volunteers. So I guess, you can do a lot about grant money too. So, which again is based on people here today volunteering their time. Which brings me to our next speaker, which is Wendy Hansen. Wendy is an attorney at Foley & Foley, specializing in employment law and compliance. Wendy works with over 1,700 clients with the firm's on-call triage service and has conducted over 50 webinars on various employment law topics. She has experience as working as a human resource manager for a manufacturing plant in Massachusetts, when she actually started from the ground up her HR department and compliance program. And she also has worked in litigation at a Boston law firm handling harassment, discrimination, and retaliation claims. But again, thank you so much for dedicating your time to this event, because it's really clear.
So I have some slides. Okay, so I can't think of a time in which this is probably a more timely topic for employers especially. Mostly because, obviously the pandemic has brought to light a lot of mental health issues that people have been experiencing, especially when access had been somewhat limited. And then on top of that, because of the pandemic, we've also, and I know this is across every industry, it's the #1 complaint I get amongst my clients, recruiting has been really, really hard. And so I can't think of a better time in which to really look towards investing in people and investing in your employees and providing them resources so that they can actually make a difference in their own lives, but also be really great employees and feel like there are people who care about them, there are industries that care about them, willing to invest in them and willing to care for them. So what we're going to be talking about is a little bit more on the employer side, what your responsibilities are, some suggestions on how to have a drug testing policy and how to implement that, what it looks like if somebody is or does have addiction issues to drugs, how you can kind of actually help that in many respects. And we're also going to be talking a little bit about marijuana, because I know that that's an issue, especially in Massachusetts, that trips up employers a lot. So we'll be talking a little bit about that as well. Okay, so I also had a disclaimer on there, because I wouldn't be a real attorney if I didn't. But obviously this is for informational purposes only, and there's no attorney-client privilege for questions answered, okay? So drug testing policies are really important. And in many respects, a lot of times people feel like maybe it doesn't need to be distilled down in a policy, but I think it's super helpful because it gives you some parameters around which you can point and direct employees to. It's something when you're doing orientation and when you're doing training, it's a policy or issue that you can bring up in your handbook. So you obviously want to make sure that you state within your policy some basics, right? You want to make sure that you have some sort of statement saying which drugs are allowable on property, which is nothing. But you want to make sure you have a remunerated list, and also abuse of prescribed drugs as well. You want to make sure you include that. But also, you want to talk about what testing you implement. So there's all different types of testing that you can do as an employer. There's pre-employment, which is before somebody, while they're an applicant, you make them a job offer, say, okay, we need you to go get drug tested before we hire you. There are randomized drug tests. I would recommend not doing random drug tests unless you have a policy on that. You don't want to run into discrimination issues and say you're hand-picking people. Also, there's post-accident testing. So anytime there's been a workplace accident, you can do drug testing after that. And then reasonable suspicion testing. And that one is kind of the hardest one. It's where you get, and I don't know if it's necessarily a good thing, but you get to put on your lawyer or your police hat, and you determine whether or not there's reasonable suspicion that someone might be under the influence while they're at work. And what you want to really be able to do, and what's super important when it comes to reasonable suspicion testing, is making sure your supervisors, your managers, and yourself are really well educated on what it looks like to be under the influence. So obviously, you don't want to make suppositions, you don't want to make assumptions, you don't want to use it as an opportunity to get rid of a guy you don't like, right? Because you don't want to run into discrimination issues. So you want to make sure that you have that reasonable suspicion observation along with the drug test in order to be able to take any form of disciplinary action or providing them resources or doing a return to work arrangement or anything like that. So it's crucial to make sure you kind of delineate what those are and what that looks like. And I think in most good policies, it's really great to have a checklist for your supervisors as well, because then it's something that's written down, it's recorded, they can observe it, they can sign off on it, they can have another witness attest to it, and that way you get a really good holistic observation. And mostly, it also allows you to give an opportunity to confront the employee about it. It doesn't stay kind of suppressed under the rug, something that's easy to hide around, right? A lot of times those confrontations really do bring out an opportunity for somebody to be able to address an issue that they didn't necessarily realize they had. You know, obviously acknowledgement is a really important aspect to that. And so getting that type of training into your supervisory level and to yourself as well, especially if you're a small employer, you're the sole manager, making sure that you kind of are aware of what you're looking for. So one thing that's also really effective is having a return to work agreement. And I've worked on several of these. Sadly, I've worked on a lot of these over the last 2 years during the pandemic because it really has brought a lot of addiction issues to light that hadn't been there before. But basically what a return to work agreement is if somebody ends up going in, you know, being under the influence while they're at work, and they end up having to go to inpatient services or go to some sort of addiction recovery program, it gives you an opportunity for when they come back to say, okay, you're coming back, we're going to do some randomized drug testing with you when you come back. We're also going to require you to go to your follow-up appointments. That's going to be a part of the agreement. Anything, you know, if there's any sort of adjusting scheduling for them to go to daytime, you know, groups or meetings so that they can get the addiction services that they need. And also just letting them know that, you know, this is an opportunity for us to give you a chance to be able to come back to work. Now the consequences within the agreement can be adjusted to what your workforce needs. Obviously you want to be understanding, obviously you want to give an opportunity, but you also, especially if you work in like safety critical roles, you want to be able to, you don't put anyone else at danger while they're in the workplace. So it can include, you know, termination right out if they violate the agreement. Some people have asked that they were required to check themselves into another inpatient program. It could also be a disciplinary warning. So there's a lot of flexibility you have, and obviously it can depend on each particular situation. And so that's something that's really important as well. I would really recommend not drafting these agreements without having an attorney look at it first, mostly because they get a little hairy. Also because substance abuse and addiction can be considered a disability under the ADA, as well as eligible for the PFML and the FMLA as well. So it's really important to make sure that you're having a return to work agreement that gives you the opportunity to kind of narrow things in and actually assist this employee while also not creating a discrimination issue as well. And then one of the other things, and I kind of forgot to put this on the slide, but I thought it'd be really important. When you do have those interactions with employees where you realize, okay, there's actually a really serious issue here, you need to likely go and seek help, you probably need to do some inpatient services, or they've already been checked into a facility, and you know, they let you know after the fact because usually you can't have much contact with those employees. They could be potentially entitled to job protected leave. And I think the best way to have that conversation is to say, don't worry about it. You have leave available to you. You're not going to lose your job for this. And that's something that's really important for them to understand. That's both with Massachusetts Paid Family Medical Leave, which I know we all know and love by this point in time. It's been around for 2 years almost. But basically, you want to be able to make sure that they know that they have FMLA available, which is unpaid job protected leave, right? That's 12 weeks. And then they have Massachusetts Paid Family Medical Leave, which is a form of payment that they can get, at least at a reduced rate, so that they can have money that's coming in. And it also requires the employer to extend their benefits and extend their health insurance, which is going to be super important if they're going into an inpatient clinic, right? So, and now granted, if you go through the state still has to approve it. That's the other kind of caveat with Massachusetts PFML. A lot of times it can still be considered, you know, a serious health condition under the law. So more likely than not, the DFML will approve that. But if you have a private plan, likely the private plan will approve it too, especially if they're being admitted into some sort of inpatient care. The other piece too is that even if they're not eligible for the PFML for whatever reason, because it's a pretty broad eligibility range, or they're not eligible for FMLA, they could still be potentially eligible for leave under the ADA. So the EEOC has stated that leave can be considered a reasonable accommodation, which means that, you know, if they need to take leave for a month or 2 months, you can allow that leave unless it doesn't impose an undue hardship on your business or burden on your business. So just think of those 3 options when you're having that conversation with the employee, when, you know, especially if it's something that you've noticed while they're at work, you notice that they were under the influence, or having a conversation with them, making sure that they know that they have resources available to them to protect their employment, which is super important as well.
Question, please.
Yes.
What if you decide not to have a work agreement, you check the person and you fire them? Are they going to win coming back?
No, I mean you could still fire somebody for being under the influence while at work, and there's no requirement to accommodate people who are under the influence, right? Especially if there was a work-related accident or there was some sort of performance error. You know, there is still, as from an employer standpoint, you still do have a pretty good cause for termination there. With that said, you know, I think it's kind of coming from the investment standpoint and knowing how hard it is to recruit people. It's probably worth it to come from a perspective of, okay, what can we do to help? Yeah. Any other questions? Yes.
Is there any protection for someone? I have a recent client who's in early recovery and was sought after in recovery to take a new job, which he did, and he is still, he's in early recovery. The pressure of the job is really getting to him, but he wants to hang in there. Is there any protection for someone like himself who hasn't shared this with his employee that he's
with his employer? Yeah, there still could be. I mean, I think, and he's just like a few months into this new employment. Is that what it is, or
he's weeks into new employment?
Okay.
It's very stressful. He's doing okay. He's getting support, but
yeah,
he may need additional support, like time away from work to have coaching and therapy. That
so he could still, I mean, likely he still is eligible for PFML. So it'd be good for him to let his employer know, because he could likely apply through the DFML for that type of leave if he needs, and it can be intermittent, so it doesn't have to be continuously.
But what about just job protection?
Yeah, job protection is coupled with PFML as well as the ADA. So there is level, they can't fire you for having gone to PFML, right, or having taken leave under the ADA. That's the whole.
But they can fire you if you're for non-performance. So.
Yeah, no, and that's kind of where the problem lies. So it's probably better for them to get on PFML or get an accommodation under the ADA now, because then likely he's getting the resources that he needs in order to be able to perform well while he's at work. But it also kind of just alerts the employer to know, okay, this is something, he's a little bit more protected here, a little bit more immunized. A lot of employers, and rightfully so, should be a little bit cautious to fire somebody while they're out on intermittent leave or accommodation. Mostly just because you know, you have to really show that performance is the reason and it's not retaliation for having taken leave. Any other questions? All right, so I want to talk a little bit about this, especially with regard to marijuana and alcohol. So what are the employer's rights? You do not have to accommodate people using drugs while they're at work, right? That's not something that you have to allow, especially with legalized marijuana, both recreationally and medically. And you are allowed to terminate someone who is coming to work under the influence or who has performed poorly because they were under the influence. But one of the things that's really important to understand is that having those resources available to employees is something that's really going to help them. So even though it's not something necessarily, you know, it might be if they go to a treatment program under the FMLA or ADA, if they're not willing to reconcile with that yet, not even willing to get to a treatment program, probably is better to kind of consider more disciplinary action. But you have a lot of resources available to you, and you still are allowed to have a drug-free workplace. That's simply something that you can do. And to the point where one of the things that is important about a drug policy, if you do have, or you are required to comply with the DOT because you have CDL licenses, just a reminder, marijuana is still federally illegal, right? So you still do need to include marijuana on your drug screening panels. And if somebody does test positive for it, it's still considered to be something that you would have to send them to resources, and you wouldn't be able to bring them back until they have gone to those resources under the DOT policy. So one of the things that's also important to understand about drug testing policies is, and this is usually my recommendation for most employers, and this is specifically to marijuana, take marijuana off the pre-employment drug screening. It's just going to be so much more simple to deal with, mostly because marijuana stays in your system long after the effects have worn off. And so you're going to get people who are taking it medically for an actual condition. It will still show up in their pre-employment drug screening, but they weren't under the influence when they were taking that drug screen. And you're going to eliminate, to be perfectly honest, a lot of great candidates from your position if they are test positive for marijuana in that pre-employment drug screen. So I would just remove it. You could still keep it if there's a reasonable suspicion issue. You can still keep it if there's a post-accident issue. Again, if you observe behavior of someone being under the influence and you send them to go get a drug test, those are the two couple things where you can start to have a conversation with somebody. But I would just take it off altogether. And the reason why, as well, is in Massachusetts, I'm actually just go to my next slide. Okay. So in Massachusetts, The other piece, and this is where it gets, if you want to be a law nerd like me, medical marijuana can be considered an accommodation under Massachusetts disability law. So there's the federal law, which is the ADA, right? Each state usually has also created their own disability law. And under a case that was passed, I think, back in 2018, the Massachusetts courts have decided that medical marijuana can be considered an accommodation. So if somebody shows up to a pre-employment screening, they test positive for marijuana and you say, okay, you're out, and they have a medical marijuana card, you have to walk through the interactive process, determine a reasonable accommodation, and determine its undue hardship before you go through and say, no, we're not going to hire you, or you're terminated. So it's really important to keep that in mind. There is still a protection there for people who use it for medicinal purposes. And that's kind of the weird caveat that Massachusetts has, unlike other states, and unlike the ADA, obviously, because it's federal and marijuana is still considered legal. So keep that in mind when you're doing your drug testing policies. Keep that in mind when you are communicating with employees. It's always much more helpful to provide things as a resource. You know, Kate mentioned EAP. I cannot stress that enough, and hopefully there are some more resources for small employers, because that really does give an employee an opportunity to kind of reconcile where they're at. And you never know where they are on their journey with addiction. You never know where they are as far as acknowledging it. So sometimes these situations and instances can really act as a catalyst or kind of the change agent, really, for people to start reconciling with that. And obviously weigh that in your mind. If it's too dangerous, if it's too much of a risk, if it's something that you've talked about multiple times, then sometimes termination does have to be the result. So I would say weigh that out as far as those options go and what would work best. And then in the next slide, it just kind of talks about what we offer as services for Foley and Foley. So we do have a reasonable sufficient drug testing policy, and we also have our on-call triage service. So we'll send those slides out after, I guess.
Have they set a limit on the amount of alcohol and marijuana the test comes through to say you're under the influence? So I have an employee, and I think they're stoned. My policy allows me to say, I think you're stoned, go get a blood test. Blood test comes back. Not just that you have marijuana in your system, but actually gives you a readout. They used to anyway. On parts per billion and all that. Have they actually set a limit that it comes back X? You are absolutely under the influence?
Yeah, no, unfortunately not. I mean, they could give you a little, but it still is not going to be a determining factor as to whether or not you're under the influence, which is why marijuana can be so complicated to deal with. So you always want to make sure, I mean, it's enough to have that reasonable suspicion. I've observed your behavior, I can see that your eyes are bloodshot, that you're obviously incoherent, there's some other behavioral issues going on, and the positive drug test, that's all enough to say that you're under the influence. Any other questions? Yeah, it's a great question. Yeah, thank you guys.
Thank you.
I mean, as most of you know, I'm a school counselor and I'm a mental health therapist, and the importance of knowledge is power, okay? And I hope you guys received as much information as I learned today, and just being able to take this information and share it with other people that you either work with or whatever. But I don't think it could have come at a better time for our next speaker, who is Dan Serpico. Dan Serpico was with us in 2019 and presented here, and he was a great speaker, and I hope you enjoyed him as much as we did, and I'm so glad that you've come back to join us again. He is a 30-year veteran of the IT industry, most recently as the CEO of a private global software company with over 400 employees. He was previously a CEO and president of Fusion Storm, which was a San Francisco-based IT solution company. He was recognized as one of CRN's top 25 innovators of the year and was awarded EMC Partner Executive of the Year. Dan has personally lived a life of sobriety for 33 years. He and his wife, Kate, have been married for 36 years, have 5 children. Dan now is going to talk about the cost of substance use disorder to corporate America and how, through his corporate leadership, he tackled the disease head on. So please welcome him.
very much. Great to be here this morning. I do not have any stories. So one second to get organized here. So today marks, as you indicated, today marks 33 years, 6 months, and 9 days of sobriety. I say that because the world today is very different than it might have been because of my sobriety. You don't know me, so let me introduce myself a little bit. I was born here on Cape Cod. I left, swore that I would never come back, and now we live here full time. You can always return, I guess. I went to Barcelona High School. I went to college at what was then SMU, or Southeastern Mass University, now obviously UMass Dartmouth. Graduated in 1980, and as Wendy indicated, I have a wife, Kate, in the back. We've been married for 36 years and 5 beautiful children, all grown and on their own. In parallel, I would say that my corporate career has been successful. After several years as a CFO for several companies, small and mid-sized companies, I became the CEO of a tech company, as was mentioned. During my tenure, we grew from $450 million to $1 billion. We sold that company to a British company, and I'm now running a global software company that is private equity backed, smaller, but private equity backed. And I also serve on a variety of boards, golf, by the Pan Mass Challenge, and I've been to Burning Man. So, the obvious question is, so what? Right? What is the relevance of all of that? Well, in my view, none of it. None of it, not the corporate success, not the love of my family, not the social network, none of that, I believe, would have happened for me had I not been sober. I do not believe that I would have had the physical or the emotional strength to succeed in all of the areas of my life that I've been successful at. And I think that's important. This doesn't mean to say that I'm against alcohol. My wife and I have a very social life. We have friends. Wine is certainly a part of those occasions. It's just not for me. And so I think there is a balance that you can find under the right circumstances. So the question is, how does all of this relate to you? Most of you are successful business people or leaders. You run companies. You're managing a payroll. Let's put it another way. You are the custodian for your employees' lives. I know that sounds a little preachy, but it's true. Think about it. Most people spend more time at work than they do anything else during their day, including, as most of you probably know, sleep. And so that means they derive enormous benefit out of work, monetarily, emotionally, socially. And it puts you as the leader of the organization in a very different and very important position of influence in their lives, in the lives of your employees. I read an interesting article the other day. Larry Fink, who is the chairman and CEO for BlackRock. BlackRock is a huge private equity, money manager, investment firm, hugely publicly traded, hugely successful. Larry Fink is the CEO, and he said, when asked what the top priority for business leaders today, he said, CEOs need to be asking themselves if they are creating an environment, in all caps, creating an environment that helps them compete for talent. I think we can all appreciate that, right? To put a fine point on an artist sharp pencil, someone once asked me, Dan, what do you do as CEO? I said, look, I do nothing. My job is to find other people and to create an environment that allows other people to do the things that make this company successful. And I really believe that. Any way you look at it, your people are your biggest, most expensive, and most important asset. So let's talk about the workplace today, right? And the role that drugs and alcohol play. I think we probably all know this intuitively, but it's worth repeating. Drug and alcohol abuse and employees abuse them create all of the following problems for you and your business. Tardiness, sleeping on the job, hangovers or withdrawal that are affecting job performance, poor decision making, loss of efficiency, illegal activity like theft or selling drugs on the job, lower morale for coworkers. We're going to talk about that some more. That's really important and often overlooked. Poor interaction with others, creating high turnover, leading to extra recruiting and training costs. All of those things are happening in your organization today as a result of someone with a drug or alcohol abuse. Particularly think about the last couple of bullet points, right? It's not just that the alcohol abuser is affecting their own job performance, but they are affecting the work culture that you're trying to create around you, okay? So Billy or Sue's problem, right, really is your problem, okay? Look, I think we all know this from other reasons. People leave the workforce because they feel like you have favoritism to someone else. They're not getting enough overtime. They're not getting job promotions. Somebody else has a problem with their environment. You know, they don't like their attitude, etc., etc., etc. You can't underestimate the impact of the drug and alcohol abuser on their co-workers. And it's not just the cost of that worker, it's the cost of the 4 people who just left you. Right? So all of that is an important part of the equation. Money, of course, is a critical factor, right? Let's look at just some stats. 11% of heavy drinkers and 18% of drug workers missed work in the last month due to a hangover or just because they didn't feel like going to work. 6% of heavy drinkers or drug users went to work drunk or high. Some even continue to use or drink while at work. Heavy drinkers and drug users take 3 times as many sick days. 3 times. Right? Especially after Patriots games. 16% of emergency room patients injured at work have alcohol in their system. Think about how the impact on your workman's comp claims policy. Heavy drinkers and drug users are 5 times more likely to file a workman's comp claim. 5 times. That's the math. That's just some of it. So you know your business better than me. What is this costing you, really, is the question you need to ask. So what can we do? Look, I'm a math guy. I'm a finance guy. I'm a math guy. I run a software company. We think about things like EBITDA and ARR, and gross profit margins. So math is important. The KPIs are important. But today's work is demanding more from a company culture than just math, right? Recently I got a communication from Marsh McLennan's, the huge insurance company. This is a little bit meaty, so bear with me. It read, I think it's important. It said, the race for talent is nothing new. What is new, however, is what it takes to win. Higher salaries, wages, and bonuses may once have been enough to attract and retain top employees. In today's job market, though, employers need to provide for an employee's overall well-being. Resources and benefits that holistically support employees, such as programs that promote good mental health, successful retirement planning, and financial security, elevate your benefits offering and help position you as an employer of choice. It's more than just money. Critically, this doesn't end once you hire top talent. Since 2020, the number of workers quitting their jobs has increased almost monthly, creating massive turnover, now referred to as the Great Resignation. An elevated approach to benefits will not only attract top talent by showing them you know their worth, but retain them as well. What they're suggesting is that we need to take a holistic view of the workplace and our employees within it. Okay? Recognizing all that and the impact of drugs and alcohol can play, how can we affect change? At my old company, we had an employee benefit written into the handbook. Anyone who felt that they needed the help of treatment, the company would pay for it and it would stay confidential. A few people took advantage of that, which was great. It was great to be in a position to help. If we were a much larger company, obviously smaller companies may not be able to provide that benefit. But you might want to make sure that your insurance plan has that benefit as part of it, as a way to defer the cost. Okay? It's not just about making money available. Company culture is more than just a buzzword, right? We're talking about people, and to be their best, people need an environment they can trust. They need positive human interaction, honesty, and integrity. And we need all, by the way, we need all those things, not just at work. We need it at golfing partners. We need them at events like this. We need them at our friends, right? Sort of common sense. In line with that, what has become commonplace today is for companies to provide leadership training for their supervisors, their managers, sexual harassment and discrimination training. I think Wendy talked about some of these things are equally important, in fact required in many states today. Related to today's topic, does your team recognize the possible signs of employees with alcohol issues? There is definitely an emotional component of addiction of any kind. Depression, isolation, physical signs like often tired, red eyes, and so on. These could be signs of someone with a drug or alcohol depression. Or problem. I think I said depression, problem. Are you open to the possibility that you might have an employee that needs help or an intervention? What if an employee came to you and said they needed to go to treatment? How would you react? Would you embrace them? Would you have empathy for them? Or would you be critical of them? Would you pay their salary? Some of the information Wendy provided was also very important. Do you know a counselor that could help them? Does your HR person have the skills to deal with an employee who is struggling and guide them to help? In other words, is there an awareness to drug and alcohol abuse part of your company's lexicon? If not, do you know where to go to learn more? Basically, what I'm asking you to do is to take this conversation out of the closet. And I think, as Joe and I were talking about, to harken back to the example I gave earlier about what we did at Fusion Stone, where we provided this benefit for others. Really, it was less important that 2 or 3 individuals took advantage of that. And to this day, I don't know who they are, nor do I care. So the whole idea was that it could be confidential. But what was more important about it is that it brought the conversation out into the open, and it allowed people to talk about it, to share, to seek help, to not be embarrassed by it, and not hide it. So the question is your organization progressive enough to open that up? Before I came today, I did a quick Google search and came up just with a few ideas around information. You've seen lots of these, so I'll just rattle these off. But alcoholism in the workplace, a handbook for survivors, www.opm.gov. Facts about alcohol and workplace issues, https, alcoholthinkagain.com, and so on. I've got a list of them. I'll spare you reading them all. Again, a quick Google search will give you or your HR people resources to start to look and understand how to identify drug and alcohol abuse, how to be aware of it, how to engage. Look, you can also call the professionals. Caring Foundation, Betty Ford, Gosnold is not that far from here. I'm sure they would be delighted to have someone come to your organization, give a lecture, give a training, speak to your staff, and provide real education, or the beginnings of real education, to bring your company forward and into the light, sort of out of the dark ages. Right? I mentioned health insurance a few minutes ago. This is an enormous cost to any business, right? And it gets just more and more every year, especially for small businesses. So what has become very common in today's workplace is something that's called workplace health promotion. okay? Basically, it's preventative care or preventative promotion around healthy habits, healthy environment, healthy workplace, right? Think about it this way. Why do dental insurance companies pay for your cleanings twice a year? Free. Because they know that the cost of a cleaning is a heck of a lot less than the cost of a filling or a root canal or a crown and bridge. Right? So the same methodology is being applied in today's more progressive environment around healthy tips to employees, monthly seminars around how to eat healthy, how to do a proper workout, any number of things, mental health, work-life balance. But there are thousands and thousands and thousands of topics that companies take an hour every month and they incorporate as a means to communicate to their employees and help them live healthier, happy lives, if for no other reason than to lower their insurance costs. Okay? But it also is a progressive, open movement that is being embraced by companies today. Right? If you accept that notion, why not include the notion of alcohol and drug use as part of that cycle? Okay? We did that as well. Okay? It costs nothing except an hour, one day, out of 1 month. So there's no shortage of ways to get engaged, help your employees, help your business, and all at the same time. According to a recent Gallup poll, 46% of adults reported as having substance abuse in their families. That's almost half of the people in your workforce have had some sort of alcohol or drug abuse in their family at some time. So nobody gets away with this unscathed. So we know this issue is real, and we know that it is enormously expensive to any good business. The trick is for you as leaders of those businesses to allow the conversation to come out of the closet, and that's where it starts. This is a major problem. It's probably impacting your business today without you even knowing about it. If nothing else, I encourage you to be proactive. The problem is as big of a concern as rising interest rates, maybe even more. And clearly there are lots of ways to attack the problem. But again, all I'm asking you to do today as leaders is to take a risk. Take the first step. Build a plan to help understand and address substance abuse in your workplace. Your employees and your company will be better for it. Thank you very much.
Excellent.
Yeah, as you can see, it was really great to have you back, and thank you for all that insight. One of the things that I think is important that you point out in working with kids in school system for the past 25 years, I've always said about the importance of proactive. Let's get it to these kids earlier rather than reactive when the problem has emerged. So thank you for putting that out. And the other piece as far as the stigma. We need to break this down. We need to be able to have conversations and embrace it because it's real and it's happening here on the Cape and as well as all over the place. But thank you. Judy, question.
I just
Yes,
wanted to
apologize.
make a comment. I want to say thank you, Dan, for bringing up the fact about the family side of it as well, because, for that ripple effect. So not only are employers dealing with an individual struggling, but look at all of those family members who are going to work on a daily basis, and whether they're sitting at a desk or doing something else, and the manpower that is lost because they just cannot focus on their work.
And Joan brings up to the other piece about the mental health component. You know what I mean? We know the comorbidity between mental health and substance use is huge. So if people are dealing with that within their families and possibly self-medicating themselves as far as dealing with it, so it is a huge ripple effect. Any other questions for Dan? Thank you so much. Our last speaker is Donna Mellow, and I've had the pleasure of working with Donna Mellow for many, many years now. She is a native Cape Codder and has worked at the AIDS support group of Cape Cod for over 20 years. She and her team have trained more than 2,500 individuals, community events across the Cape. Donna will discuss about Narcan, how to recognize an overdose, etc. But I do want to say, I think it was 2013, that Donna and I and a couple of other people, John Douglas from World Police and Sean Cahill, it was just such an issue going on in the Cape. We did a Narcan training here in Vaughan that many years ago, and we had over 100 people in attendance for that in 2013. So I really appreciate all the hard work you do.
So my name is Donna Mellow, and I work for the AIDS Support Group of Cape Cod. I've worked for 20 years in different capacities. This is a medical case manager for 14 years, onto prevention and education, doing counseling and testing, and now I do community education. So thank you for letting me come and talk about Narcan. Our mission statement, we always want to put that out there. The AIDS Support Group of Cape Cod saves lives through prevention, education, and life-sustaining services that address public health crises to build healthy communities across the Cape and Islands. The AIDS Support Group of Cape Cod has been around for 50 plus years since the beginning of the AIDS epidemic. We've been talking a lot about epidemics lately, the COVID epidemic, obviously. But the substance use crisis, the overdose crisis in our country is another epidemic. 90,000 to 100,000 people die of overdose every year. So we do prevention and screening services, overdose prevention education, including free Narcan, and I brought enough Narcan. If everybody would like a kit before they leave, I would welcome you to talk to me afterwards. We do syringe disposal and syringe retrieval services. Sorry, I haven't done this for a while. Access to sterile syringes and ancillary safer injection supplies to prevent the spread of HIV and Hep C in our community. HIV, Hep C, and STI testing, counseling, and treatment. Access to PrEP. It's a pill taken daily to prevent HIV. And PEP, which is post-exposure prophylactic therapy. And we connect people to care for all things related to health. So I'm a harm reductionist, and so my question, and most people ask, what is harm reduction? First of all, the most important thing I think about harm reduction is that we meet people where they're at, without judgment, without just discrimination. We treat people with dignity. We're non-judgmental, non-coercive provision of services to people who use drugs in order to assist them in reducing attendant harm. So, what are the harms of drug addiction? Obviously, addiction is the biggest one, right? Contraction of HIV and hepatitis B and C. We've seen lots of people with damage to their veins, endocarditis, different diseases, overdoses, of course, which is why we came over here to talk about. We recognize that the realities of poverty, racism, caste trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability to and capacity for effectively dealing with drug-related harm. So we do not attempt to minimize or ignore the real harm associated with illicit and illicit drug use. We all practice harm reduction every day. So examples of harm reduction is we wear seatbelts. Okay? It doesn't guarantee we're not going to get into an accident and get killed, but it offers us some protection. It reduces the harm. We wear sunblock in the summer. We don't want to get skin cancer. It's reducing the harm. We still can get out in the sun, but maybe we won't develop skin cancer. We wear helmets when we ride motorcycles or bicycles. Head trauma in an accident can kill you or debilitate you for life, but the helmets are going to reduce the risk. So examples of harm reduction for people who use substances. don't use alone. So now I'm talking about people who may be abusing substances, right? Or using substances such as injection drugs. But the fact of the matter is anybody who takes an opiate is at risk for an overdose. I'm now hearing about places like the Community Health Center of Cape Cod, that if you get an opiate prescription, you get a free Narcan kit. Love that idea. Because you could be an elderly person, and you could have worked in construction for the last 40 years and have back issues, and be taking opiates for pain, right? You could be an older person who maybe does get pain medication, but also takes a benzodiazepine because you have an anxiety disorder, right? Maybe you like to have a few drinks at night. All three of those, the opiates, benzodiazepines, and alcohol, all suppress the respiratory system. So you could be an elderly person, I'm just saying elderly, but it could be anybody, and maybe combine those substances and overdose. It could happen, right? Because what is an overdose? What opiates do is it suppresses the respiratory system, okay? So if you're doing a number of different substances and you overdose and you have Narcan, we've been giving these out to older people as well. We're at the Family Service Center, we're at foundations, we're at Recovering Champions, we're different places. And when I go around, if I go around the parking lot at the Family Service Center and I talk to people about this, they will say, well, I don't know anybody who abuses substances, but you don't have to abuse them because accidents happen. Okay, so helps take the judgment out of that too, I think. Although people who are using substances, who are injecting substances, we tell people don't use alone. If you use alone, you die. There's no one there to administer the Narcan or call 911. Fentanyl is the biggest issue, and I think that's what we've really been seeing in the last 5, 6, 7, 8, time goes by so quickly, maybe to be my age. It's probably been 10 years for all I know. Fentanyl has been the issue. And so fentanyl is cheap. And people are taking fentanyl, crushing it, selling it people have pill makers, we'll start there, and can make fake Xanax or fake, Percocet or whatever, and they sell it on the street, and it's fentanyl. People are putting fentanyl in cocaine now. We've had a number of overdose deaths for people who, party on the weekend, do a line. They're opiate naive. And because there's fentanyl in the drug, they've overdosed and died. We even heard about fentanyl in pot, in marijuana. So fentanyl is an opiate analog. There are many different fentanyl analogs out there, and they're all different strengths. You don't know what you're getting. So one of the things that we're doing now is that the age support group is providing fentanyl test kits. We actually had someone come on our mobile van recently. He took Percocets by prescription, but he had been taking 5 milligrams a day, 3 times a day, for many, many years, and he wasn't abusing them, he said. His doctor wouldn't prescribe anymore, so he went online and he ordered them. And he brought them in and said, I just want to test it, and so he did test it, and it was fentanyl. Now, if he had taken it, he could have died. Because fentanyl can be 50 times more, what's the word, Kate? More potent, sorry, what I call it, Kate. 50 times more potent than heroin, okay? We have people test their fentanyl, test their drugs for fentanyl. Another harm reduction technique is to carry Narcan and to know how to use it. And make sure that people around you know how to use it as well. We tell people who inject drugs go low and go slow, because you can always use more drug, but you can't use less, right? But once it's in your vein, once it's up your nose, it's already done. So, and one and done. Use sterile works every time. If you're going to use, we've had people, before the syringe access program was legalized, we've heard of people who would take their syringes and put it on a book of matches and kind of file it down and use it. And they would get infections, obviously, bits of metal inside their veins, and then we want to reduce the harm. That's what harm reduction is to. We want to reduce the harm that drugs are doing in our community and to work into individuals and make it possible for them to live another day and make and choose sobriety. But it's their choice. It's not our choice. We don't judge. So opioids, what can Narcan do, right? So some prescription opioids are Oxycontin, oxycodone, Percocet, Vicodin. You need a prescription to get those unless you're on the dark web. And then there's street dope, so heroin, fentanyl, and as I said, there are other opioid analogs. I know 2 years ago there were 24 of them. There are probably many more now. And medications for opioid treatment, methadone, Suboxone, and Vivitrol. You've probably heard of all of those. The other thing is really important. Fentanyl we're finding fentanyl present in stimulants, so coke and crack and crystal meth. So it's out there. A manufactured pill sold as something in the Benzo family. Like I said, we've been finding fentanyl in Xanax, Valium, Clonidine. And the important thing is Narcan will only work on the opiates, right? The opioids. It's not going to work on anything else. So let's say that I've overdosed, I've taken back 10 milligrams of Percocet, and I'm kind of feeling a little whatever, so I take a little Valium, maybe have a couple of drinks. Well, you know, it's Friday. No, I'm kidding. And so, if you use Narcan on somebody, it's only going to take the opioids off the opioid receptors. So I'm still going to feel the effects of the Valium and the booze, right? It only works on opioids. But if somebody's in an overdose with a combination of drugs, taking those opioids off of the receptors could get somebody started breathing again. So maybe enough, right? Of course, you're always going to call 911 this. Methadone, Suboxone, and Naltrexone are used for opioid addiction. They are, they attach themselves to those opioid receptors and some of them block that craving and give you a little bit of opioid to kind of calm those opioid receptors down. Works for a lot of people. It's very popular today, medication-assisted treatment. Something that's important too is that different opioids have different potencies and they last for a different amount of time. So methadone, you can only get from the methadone clinic, pretty much. Maybe you can get it from your doctor, but not usually. The duration of the methadone lasts for 16 to 32 hours. Heroin lasts for the effects of it last for 6 to 8 hours. Oxycodone 3 to 6, morphine 3 to 6, and fentanyl 2 to 4. Another reason why we're so concerned about the fentanyl is because it only lasts for 2 to 4 hours, people are injecting more often. And the more often that you inject, the higher the risk. If I have to inject every 2 to 4 hours and I'm using 10 different syringes, or I'm using the same syringe 10 times, there's just more risk. And fentanyl even though when you're not feeling the effects of the fentanyl, like maybe you're not high from the fentanyl, it's still in your bloodstream. So you do another, and that's on top of what you've already done, because that's still circulating. So the risk of overdose for fentanyl is very, very high. The other thing about fentanyl is that fentanyl attaches to the opioid receptors very, very quickly. It's different than, like, we'll say, heroin. Oftentimes when people will use fentanyl, they go up very quickly. If I use heroin, I would probably, my words might start to slur. I might go into a nod. I could be drooling on myself, right? And then I could, maybe get that death rattle, that little gurgle, right? And I could, my heart could, my respiratory system could be suppressed and I could die. But with fentanyl, what we've seen in the past is that it acts very quickly. It attaches to those receptors very quickly, and oftentimes somebody will go out very quickly. You miss that whole, time when it's setting up that maybe you can intervene. They're going out very, very quickly. And another thing that we're seeing is this they're calling it wooden chest. Because what happens is because you because it attaches so quickly and it just interrupts your breathing so quickly that your chest becomes, it's very hard to do chest compressions on somebody. It's so different from the other opioids that we've been seeing. So Naloxone is commonly known as Narcan, the brand name. It's the antidote to an opioid overdose. What it does is it blocks the opioid receptors. What's really important is that it can take those opioids off of the receptors, but the opioids are still circulating in the bloodstream. Okay. So let's say that you have an employee who goes out and you give them the Narcan and they come to and now they're breathing. You need to call 911. Because the opioids are still circulating in the bloodstream. This is only going to last for 30 to 60 minutes. It doesn't last all that long, 30 to 90. Doesn't last that long. And when this wears off, those opioids are still circulating in the bloodstream, they can go back out again. Okay, very important to call 911. Sometimes people won't call 911. And what I say to them is, maybe they have a warrant for their arrest, or maybe they have a lot of drugs in the house, or maybe there are weapons in the house, so they don't want to call. This isn't going to affect you really. But my advice is always stay with that person. Do not leave that person. All right, so how does Naloxone work? So it knocks the opioids off of the opioid receptors in the brain, and we have opioid receptors all through your body, but the ones that we're really concerned about is with the brain. And it blocks those opioids from reattaching. Okay, it doesn't flush them out. Like I said, it's still circulating in the bloodstream, but it does restore breathing. Oftentimes we're hearing, it takes 4 doses, 5 doses, 6, 7. I mean, I've heard as much as 13. I mean, that's. But let me just say that, this is what you're supposed to, and we're going to get to it. You come across somebody who is unresponsive, right? You shake them, call their name, done the whole thing, and they're not responsive. And you are supposed to give them a dose of Narcan. And when you do that, first of all, they don't have to breathe it in. It's absorbed through the membranes in their nose. And it could take, a couple of minutes for that person to restore breathing. Now, a lot of times, they say wait 2 minutes. But a lot of times what happens is that 2 minutes seems like an eternity, so you're giving another one. And then, maybe you wait another, you're panicking, and you're like, I'll give another one, give another one. That's not a good idea, because what you're doing is you're just stripping all those opioids off of all of those receptors. When that person comes out, they're going to be in real severe withdrawal. And 1 or 2 might be enough. So, we're going to go run through it, but you're going to give somebody a dose, and then you're going to wait. So Naloxone will not make a person feel high. It takes that high away. People do not become intolerant to Naloxone. You can give it to them. I've heard people, it's funny because when we were in the jails, and they would say, I've overdosed 26 times, like it's a badge of honor. But the fact is the more you overdose, the more damage you're probably doing to your organs, right? Because when you stop breathing, it takes a few minutes, but your organs start to slow down and you can start to do damage. But you can't become tolerant to it, so it's always going to work, hopefully. Naloxone only reverses effects from opioids. It does not reverse overdoses from any other substances. And your drug test will still be positive even if you've taken the Naloxone. So, and Naloxone doesn't make people violent. So what does an overdose look like? So the definition of an overdose is reduced stop breathing and unresponsiveness. I think the real definition of an overdose, really, is that you've taken too much of a substance into your body and your body can't handle it. And that's why you start to see some of these symptoms, right? They're reduced to stop breathing. All right, contracted pupils, that's a hallmark of an opioid, of someone taking an opioid. Extreme sleepiness, difficult to arouse or unconscious. Slow, noisy, labored, or irregular breathing. Because the oxygen isn't circulating very well, sometimes their fingertips will turn blue or purple and their lips as well. Silent or slurred speech that doesn't make much sense. Poor coordination, collapse. all their signs. And if an overdose occurs within minutes, it's likely fentanyl, like I said earlier. So the first thing you want to do is you want to assess their level of consciousness. So you're going to call to the victim, and say their name, Hey Joe, are you okay? Maybe give them a shake, louder, call their name. If they don't respond, you're going to do the sternum rub. You're going to take your hand like this, and you can either rub it on their sternum, and if you don't do it, I've heard people doing this and like wearing their skin. You don't have to, it doesn't take long to make it, cause a little bit of pain. If it's in the wintertime and they have a lot of clothing, you can do it under their nose. And if there's no response to that, then what you're going to do is, that doesn't say that. If there's no response to pain, follow the steps. Okay, here we go. You're going to give them the Narcan. You're going to call 911. You can do both at the same time, right? People always say, what do I do first? I say, get your phone out, get all your stuff, 911, put it on speaker. You're going to give them the Narcan, and now you're able to get instruction and give information to the person on the other end of the phone, right? And you're going to rest and breathe for 2 to 3 minutes if you have to, right? So if I'm labored breathing, and you're giving me the Narcan and I'm breathing, great, right? You don't have to do, they are getting oxygen, but if they are not breathing, you may have to breathe for them, okay? And then these times of COVID, a lot of people don't want to put their mouth on somebody. We do have shield guards, but even if you don't have something like that, you can use a piece of fabric, a tissue, anything. And just cover your mouth, cover the air mouth, and blow, right? 2 to 3 minutes. Does everybody know how to do rescue breathing?
Just a question.
Yeah.
CPR. Does it use rescue breathing?
Yeah. So I know we did a CPR course not that long ago, well, a few years ago now. And they said, you don't have to do rescue breathing. All you need to do is the chest compression. The problem, or what happens when you have a drug overdose is you're not breathing. Okay. If you know how to, what they say is if you know how to do chest compressions and see if you can take someone's pulse, find out that they're not breathing, their heart's not pumping, and you know how to do that, fine. But oftentimes people don't know what they're doing, and then they've cracked ribs and they have more injury as a result of it. The thing with overdose is they're not getting enough oxygen. So if you can breathe to them until the rescue comes, that's what the state says. Wait 2 or 3 minutes and then re-administer the Narcan. Each box comes with 2 kits, and they do have the instructions on the box. This is an expired kit, so I don't feel bad using it. And this is what it looks like when it comes. I'm going to show you how to use it. So, how to administer. All right, so we're going to peel the package back. This is what it looks like. See there. You're going to hold the device between your thumb and your on the bottom of the plunger and 2 fingers on the nozzle. Okay. What you're going to do is you're going to do this. Right? You're going to place and hold the tip of the nozzle in either nostril until your fingers touch the bottom of the person's nose. So like this. Right? And then you're going to press the plunger. And that's it. I tell people don't open the package until you're down there with them because, oftentimes people grab it and they're like so nervous and then maybe they, accidentally hit that plunger and then they lose it. So wait till you're down there. So you peel it, you place it, and you press it. So rescue breathing with a mouth shield. So make sure there's nothing in the mouth. Right? If there's anything in there, you want to do a sweep with your fingers. You want to tilt their head back, lift their chin, pinch their nose, and you're going to give a breath every 5 seconds. Okay? Like I said, a lot of people don't want to do this, but you could certainly save someone's life. You're going to continue to rescue breathe for 2 to 3 minutes, and after, if they're not responsive, you're going to give them another dose. And by responsive, I mean breathing on their own, right? The recovery position is really important because sometimes when people come out of an overdose, they vomit, right? So what you want to do is you want to give them, rescue them. Why monitor this for? Because Naloxone lasts 30 to 90 minutes, but an opioid overdose may last as long as 4 hours. Methadone overdose can last up to 8 hours. We've seen people hospitalized. Maybe somebody goes to the clinic in the morning, they get dosed. Maybe they buy something else on the street or whatever, and they have to be hospitalized. And I've even heard on a Narcan drip. So anyway, you want to stay with the person during the risk period for when naloxone wears off. All right, so the recovery position's this way. You're going to take one arm and put it over their flat, hopefully they're flat on the ground. You're going to take one arm and put it over their head, the other arm across their waist, and then you're going to roll them on their side. Okay? You're going to take one leg and you're going to put it over the other because you want to anchor them. If you take them and you just put them on their sides like this, it's very easy for them to roll back. So you really want to make sure that they're in that position and they're anchored. If they vomit, they're going to vomit away from themselves. They're not going to aspirate. So most people will start breathing again in 3 to 5 minutes. Some require more doses, especially with fentanyl. Again, it's very firmly attached to those opioid receptors. Most people feel anxious, confused, and embarrassed when they're coming out. They don't know what happened, right? They don't know they've overdosed, and all they know is somebody's over me right now, and I hear police sirens coming, and they're confused. So the goal of using naloxone is to get people breathing again, not necessarily to wake them up right away. If we are in a hurry to wake them up, we are more likely to give more naloxone, which can induce withdrawal. We talked about that earlier. And withdrawal symptoms can vary. So you really want to reassure, this is really not in good order, you really want to reassure people who are coming out of an opiate overdose that the withdrawal symptoms are going to diminish, and then naloxone is going to wear off, and help is coming. I would let them know, I'm just giving you Narcan, I found you, you're okay, medical help is on its way. But just try to, kind of calm them down and inform them of what's just happened. So take care of your Narcan, right? So you need to protect it from direct sunlight and extreme temperatures. Check the expiration date periodically. I will say if it's expired, don't be afraid to use it. One training that I did, someone said, I knew somebody, there was an overdose. They had a Narcan kit, but it was expired and they didn't use it because they were afraid to use it because it was expired, right? The person died. The only thing that's going to happen is if it's expired, it's going to be maybe less effective. Something's better than nothing, right? But if it has expired, if you've used it, if you've lost it, if you've given it away, just let us know and we'll replace it. We do ask people to report back. This helps us to know, where did it happen? What town did it happen in? How many doses did it take? What did you observe? Was it a male or female? All of this information is important. All right, so that's our contact information. A couple just of other things. I had said Narcan only works on opiates. All it does is lift opiates from the receptors, so if your child got a hold of it and sprayed it up their nose or sprayed it in their mouth, nothing's going to happen. If you came across somebody at a bus stop or wherever, and you didn't know whether they were having a heart attack or they were suffering from something to do with diabetes or you don't know, and you gave it to them, nothing's going to happen. All it does is lift opiates from the receptors. Never be afraid of giving in. It's not going to harm anybody. All right. Any questions?
No.
Do we just get ready?
Yes.
So, as Donna clearly pointed out, the importance of Narcan, because Narcan does save lives, and we know that. Joe Carrera, who's with us today, is also a member of the Born Substance Free Coalition, and under Joe's direction and leadership, we were able to put together, along with another collaboration with the Mass Hill, Born Police, and Born Fire, as well as the Born Substance Free Coalition, these bags. Inside of these bags are socks, deodorants, hand sanitizer, masks, shampoo, conditioner, combs, as well as all the resources that are available to people here on the Cape. And these bags are distributed through the Born Police Department for people who have overdose. They go back to the home and give these bags out, along with someone from Bosnia also getting Narcan. But also Joe has also gotten these guys into our local hospitals, Beth Israel, Falmouth, and Cape Cod Hospital, and we couldn't have done that without Joe so much.
It was a committee, you know that, our whole committee is.
Right, but truly, it was, Joe took the lead on that, and we're really grateful. We have a great committee, the Born Substance Free, which brings me to, if anyone is interested in becoming a member of the Born Substance Free Coalition, we meet on Wednesdays, the second Wednesday of the month. We alternate our timings. We meet at 11 o'clock in the day here at Upper Cape Tac, and the following month we meet at 6. We have a Facebook page, and we are in the process of web page development. But if you're interested in becoming a member or joining us or just coming to one of our meetings, feel free to contact me. My email is eGriffin170@comcast.net. But to end this, I can't say enough to all the people here for taking time out of your day, trying to make us overcome something that's very sad and very real to our community, and with all of our help and all of us working together, hopefully we can make a positive difference in our community. So thank you all very much for coming. I hope you enjoyed it.